Although myeloproliferative neoplasms occur more commonly in patients who may have completed their family, roughly 1 in 5 patients will be of childbearing age at the time of diagnosis. So there are many things to be considered here, and it's very important to think about pregnancy, and this is often a conversation that we have with patients. We have learnt a lot from looking back at what's happened to patients who've had pregnancies in the past, and there have been many collaborations internationally between centres with an interest and who are treating many young patients with these conditions. In particular, we know more about young women with essential thrombocythemia because this condition is commoner in young women. What we've decided to do in the United Kingdom about 3 years ago was to utilise a very clever system called the UK Obstetrics Surveillance Survey, which is exactly that. It involves sending a card to all the hospitals where women are managed in pregnancy, asking them, have they come across women with certain disorders in pregnancy, and then asking them to fill in details about how the patient was managed, what happened in pregnancy, what happened in labour, and what happened to the baby. This serves an important purpose. One, it highlights and raises awareness of these conditions to obstetricians who may very rarely encounter women with these conditions. And two, it's allowed us to conduct then, for the first time ever, a prospective survey of what happens to pregnancies. We were able to capture over 50 pregnancies in the UK. That doesn't sound like very many, but actually there are only about 15 pregnancies in the UK per year affected by myeloproliferative neoplasms. It allowed us to capture what was happening in real life with regard to pregnancy outcomes, and very reassuringly, these are similar to the data that we've gathered from looking back at outcomes in our centres. We can see that around 70% of pregnancies are successful with delivery of a happy, healthy, maybe I shouldn't say happy, but a healthy infant. We can't tell till they're older, of course, and without major risk to the mother. However, we do see, as we expected to see, some increased risk of early miscarriage, probably slightly higher than the general population, and also increased risk of late pregnancy events. What do I mean by this? I mean the development of pre-eclampsia, small for dates babies, early deliveries, and occasionally children with low Apgar scores who are born small for dates. And particularly, we were surprised to see increased numbers of small for dates infants. This is something that we are not able to collect retrospectively. And because we've got such rich data in the UK about normal pregnancies, we've really been able to highlight this as an issue. I hope we've also been able to raise awareness amongst obstetric colleagues about the importance of thinking about looking at the blood count for women in pregnancy. This is really important because it forms a baseline for further studies to think about how we might better manage pregnancy, and it enforces and reassures us about our current management. What might it tell us for patients? Well, I think it tells us that actually most pregnancies for patients with myeloproliferative neoplasms are low risk. If we follow our current treatment policies, generally most pregnancies will be successful, but there is a small risk, and so it's important that we follow a path and try to manage the condition as best as possible. Secondly, for patients who need treatment in pregnancy, we've been using interferon for a long time now for the management of these conditions. We can't use other drugs like hydroxyurea and probably not anagrelide in pregnancy because of the risks to the fetus. What we've presented at this ASH is a large collaboration collecting data on a newer formulation of interferon, pegylated interferon, which we've been using now for some time for management of disease, but for which there was no data with regard to safety in pregnancy. And happily, we were able to demonstrate that this was a successful treatment and allows us to probably move more patients over from conventional interferon that can be difficult to tolerate to the pegylated form, which is much more easily tolerated and easier to give because it's only one injection a week compared to multiple injections.